One of the things that truly distinguishes Jefferson Medical College is that we see our role as not only an elite academic medical center where top researchers are, and we train students to be top specialists, but we also put a great value on primary care.
In most of these questions, there are no right answers and there are no wrong answers. The purpose is to generate good thought.
Healthcare in the 21st century is going to evolve considerably. There'll be an increasing emphasis on the interpersonal qualities where empathy plays an important role.
As you guys finish med school and go into your residency, it's a disease that I think is going to get more and more interest.
We're really looking to cultivate caring, empathetic clinicians who will engage the communities that they touch.
I think that it's really important as medical students that you obviously to learn the medical information, but it's also really important just to really develop your patient interaction skills.
You do need to learn how to talk to patients and interact with patients with real people.
A patient is not a text or a paragraph that you can read on the internet or in a book or what have you.
You need to be able to study in the classroom and know what you're doing, but at the same time you also need to be able to talk to patients, hear patient stories, and that's what's going to make you a better doctor.
For us, looking outwards is part of our DNA. And we have myriad ways of doing it right from the start.
It's amazing that even in your first year here at Jefferson that you can get out and actually work with patients.
One of the real showcase outreach activities that the students do is Jeff Hope.
So advocacy, education, procedures is already covered.
And triage. Jeff Hope is a way to actually get away from the classroom and books and see patients and learning what real medicine's kind of like how do you talk to a patient? How do you take a physical exam?
Right now we're at Sunday Breakfast Club. It's an all-men's shelter. We work with the homeless population in Philadelphia. One of the best parts about Jeff Hope is that you're actually able to get out and actually experience what people are experiencing in their lives. You don't need insurance.
For very many of our patients that don't have insurance, Jeff Hope is a real contribution to their health. Okay, here are your medications.
Thank you.
Are you interested in any supplies that we have? We have socks, soap, shampoo, deodorant.
Socks, I love socks.
Socks? All right, hook you up with that.
I think that just working with those patients, helping them when they ask for help, and really being able to connect with them in a way that they feel comfortable asking for help when they need it.
A good thing that you can do that will help your back to loosen is you start just rocking back and forth. Hands of Hope is a perfect complement for Jeff Hope because we can work alongside the medical programs and the pharmacists in order to help someone move better, a little more pain-free, improve their quality of life.
Great. Last line. Jeff Sees is an organization that provides eye health outreach for various communities in the Philadelphia area. I can see the joy in my patients' eyes when we hand out something as simple as reading glasses and they're now able to read the newspaper or their favorite novel that until now they hadn't been able to.
This is Refugee Health Partners. We take a community-based medicine approach to refugee health.
We just started a clinic for the Nepali, Bhutanese, Burmese populations centered, in South Philly.
I chose this program because I was really interested in global health, and I saw working with refugees as a chance to practice global health at home.
A huge part of global health is the variety in the different medical conditions and diseases and cases that you see.
Where is her doctor located? So if we can try to help you make an appointment. When you see people who have been through things that you cannot even fathom, and have never having access to health care. You recognize how fortunate they are to just come here.
Actually, it's kind of a very personal thing for me. I'm a son of a refugee family. My parents, they are refugees from the Vietnam War. Giving them those tools, giving them that education, giving them that health to be able to pursue what they want to do in life, it really has a profound impact on what their life is like in America.
This sort of outreach allows us to touch the lives of our local community, but through programs like Jeff Health, far beyond into the global community.
Rwanda is the land of 1,000 hills.
Yes, everyone has his own hill.
I want to thank everybody for working with all our students from America. We are very grateful. Thank you very much.
The impact of these programs is even more profound than you think. For us, it's part of a strategy of attracting the best students and preparing the best physicians.
There is an amazing amount of good that needs to be done. So when you choose medicine, you choose to give.
You help one more person maybe add another 10 years onto their life. It is really fulfilling.
Being able to touch another person's life is one of the greatest things that somebody could do.
I do this because I can see the effect we have on the patients we serve.
We hear it all the time from patients, is that they've gone through a really tough time. And the first thing they want to do is get their health in line. You're encouraging them toward a better life, toward better health. I mean, that's just a huge sense of reward.
We all go into medicine because we care about people. We want to help people. And this is it.
This is where not only do I get to learn something and understand this is the struggle of a patient, but you get to contribute.
For me, it's about remembering the humanity behind all of the diseases and the processes and the medications. It's really about connecting with patients.
There's no question that this sort of early exposure to patients makes you a better doctor.
I have an exam tomorrow, but this is a chance where I can come in and remember why I'm studying so hard.
This is more valuable to me. Honestly, the patient experience is why I got into medicine. This is what I want to do. And I get the opportunity to do it before I get an MD on my name.